Why might we lose teeth? Now, there's a number of reasons why we might end up losing teeth. We might end up having decay or cavities appearing around teeth. You can see this in a top tooth, and this progressively gets worse until it basically rots the whole tooth. This can happen because of insufficient cleaning. It can happen because of diet. Some teeth are already heavily filled. They might have cracks, so it's easier for bacteria to get into that area, so it makes it more difficult to clean. So there can be a number of reasons. Now, sometimes when teeth get to this kind of stage, they can die, and so they can end up having a root canal treatment. So you can see the root, the bit that you can see of the tooth is this, and the bit above it is this, which is inside the bone. And this is the root, which is supporting the crown of the tooth, which is this. And what will happen is that the bacteria will infiltrate those roots, because what it's trying to do is it's trying to destroy the tooth, and eventually the tooth will die, and this will manifest as an infection in the bone. So you might have come across people who've had abscesses or big swellings in their face suddenly, lots of pain, lots of swelling, lots of discomfort, really excruciating pain. This is why it happens, because the pressure builds up and it has to burst out from somewhere. So in this case, you can see the dark area above, which is demarcated by the arrow. Above it is a sinus, which is a natural hole inside your skull. So you can see it's very, very close to that. Now, the root canal treatment can be done, but sometimes even that's not successful. And in that case, because the tooth is already heavily restored, it's had most of its structure destroyed, then it's had a root canal, which might make it brittle, which might then lead it to fracture, or the tooth has to come out because it's not really viable to do anything else with it. Another reason is that you get gum disease. So this is a autoimmune disorder, very much like rheumatoid arthritis or heart disease. This manifests with the body attacking the supporting structures around the tooth, so that the teeth become loose. Now, if you imagine you're putting consistent load on these teeth every day when you're talking, the weight that you're carrying in your jaws, when you're eating, when you're chewing, huge loads, and some of these loads can be more than your own weight. So over a period of time, it's a bit like the supports of a fence, and they start to drift because there is no support left underneath. The bone is just being destroyed. You've got this massive infection, or they start to fall out. And this is how you can see this appearing. Sometimes people who have this buck teeth kind of appearance, this might be the reason why it's happened. Another reason can be is that the teeth fracture. So you can see the two front teeth have fractured. And the reason why this has happened for this particular person is because they have a very tight bite. You can see it's called a very deep overbite, where the teeth at the top are much deeper down, so it's a deep overbite. So there's a lot of stress on the front teeth. They're getting knocked constantly. Now, you might be aware of this happening. If you put your fingers on your front teeth, you might notice that these teeth are moving a little bit, or the teeth have cracks. So they have translucent cracks. If it's been there for a while, it will manifest as a stained crack. So some people, you see, they have stained cracks on their teeth, and this can usually happen because there's overloading of those teeth. So either the teeth become loose, they fall out, or they become cracked, or they start to chip. And if you look at these teeth, you'll see you'll see that they either have considerable wear on their back teeth, or they don't have back teeth. So now all that load has to be transmitted onto the front teeth. So the same amount of weight, but on a smaller surface area, means there's a huge amount of load. So these teeth are on their way out. And now if you look at this x-ray, you can see this is another reason where you've lost a lot of bone around these teeth, around here. You can see there's a lot of bone loss around these teeth, this dark area here. So these teeth have become loose, lots of infection underneath. So there's nothing else that can be done with them because it's too late in the day. But the problem here is that when you have this kind of problem, we want to deal with it sooner rather than later, because you end up losing lots of bone. So sometimes we can sit on the fence thinking that I'm going to deal with it when it becomes painful, but this can be the wrong decision to make, because you're just destroying the jawbone, and you really need that jawbone if you then want to go on to do something else to replace these teeth.